Dr. Drew, welcome to the program. It's an honor to have you, and the table is yours. What happened when you saw this diagnosis from Joe Biden and his team? Is this possible to develop Mets to the bone, Gleason score 9 prostate cancer in about 100 days?
Right. So first of all, thank you. It was a privilege to be here. Big fan of this show. And when your people came after me, I was like, well, of course, I'd be happy to be here, especially in the face of people trying to make sense of this nonsense again, being distorted, being lied to, being manipulated. I woke up this morning thinking to myself, the press should wake up this morning and think to themselves, we got played. We got played for 4 years, and this is absolute categorical evidence of exactly that. The physician you just had on prior to me, I agree with everything he said. It's exactly right. Look, I've been treating prostate cancer for 40 years. I'm on the board of the Prostate Cancer Foundation. I am a prostate cancer patient. I know this illness very well. And as soon as they said, we felt a nodule, already my spidey sense went up. Because guess what? We don't really even do the digital rectal exam very much anymore. But I thought, maybe for a president you would. You follow the PSA. And they went from, a nodule to advanced metastatic disease. Maybe somebody who hadn't seen a doctor in 5 years. Maybe. As the doctor said, maybe a 2% probability. It's not the way it went. This has been going on for a long time. And you also just heard about how the androgen deprivation therapies cause cognitive decline. They also sometimes cause frank dementia. In fact, I was talking to my own urologist, and I said, hey, if I develop metastatic disease, I do not want androgen deprivation therapy. I'm convinced I'll be one of these guys that will lose their cognition, and I'd rather try other things if it's possible. But that is the stepwise approach to prostate cancer when it shows up as metastatic.
So you're saying that it is a damn near medical impossibility to have surprise Gleason 9 stage 4 prostate cancer Mets to the bone.
The Gleason 9 part, sometimes people present with an advanced stage, so don't focus on that. And a Gleason 9 is highly probable to move along and be very aggressive. But to present in somebody who is the part that doesn't pass the sniff test is, he wasn't getting adequate care? No, that's very improbable. And by the way, people, I was looking at my Twitter feed a few minutes ago, and somebody said, this isn't the first nor the last time we'll be lied to about a president. And that's true. You got to remember, Woodrow Wilson had a massive stroke, and his wife ran the White House from his bedroom for something like 6 months. But in today's world, where we're on top of everything, it feels so deceitful and such a violation of basic ethics. The person who's running the country may be unable to think clearly, either because he had some Parkinsonian syndrome, which we've all been talking about for years, and that's separate from the prostate cancer issue. All that motoric slowing and the mask-like faces and the hypophonia, the inability to project his speech, that's Parkinsonism. That is separate from what happens from prostate cancer and prostate cancer treatment. So he had a ton of medical problems going on about which we were gaslit for daring to say, hey man, I'd like to know what's going on with this guy. It doesn't look right.
So given that this is your profession and your lane, let's talk about Dr. Kevin O'Connor, who in February of 2024 gave the last full clean bill of health for Joe Biden so that he could launch directly into a presidential run. Was this malpractice? What's your assessment here?
Well, I think he chose his words very carefully. He said he's suited for the position, something like that, which how do you even, we don't have a set of criteria for the presidency, and maybe we should. Maybe there should be cognitive assessments. Maybe there should be physical assessments, because we are living a long time. We certainly have it in my profession. You get referred out if you get too old to be practicing medicine. That's what happens in a profession where there's a lot of responsibility. People monitor it and call it out when they're having dysfunction. There's no such thing for the President of the United States.
Yeah, you wouldn't want to get on an airplane that was being flown by somebody with Joe Biden's diagnosis, with his sets of symptoms, right?
You wouldn't want him as your lawyer, your doctor, your airline pilot. You wouldn't want him as the President of the United States. And my suspicion is that the people around him didn't want it either and stepped in and started doing the governing themselves. This is a scandal, and we don't know the full extent of it yet.
Doctor, given your deep expertise on prostate cancer specifically. Can you talk us through when it was likely that they knew that Joe Biden had prostate cancer, and what will be the likely result of this diagnosis?
So it's what normally happens is you follow the PSA and it starts to pop up. You go, hey, let's do an ultrasound of your prostate. Oop, look, we see something there. Let's biopsy it. And if you have a Gleason 6 or less, you might just observe it. Those are not aggressive tumors. You're eventually going to need some kind of treatment. And if the grade and the size starts going up with future biopsies, it's called active surveillance, then you jump in. Somebody Joe Biden's age, you probably would do something like external beam radiation or perhaps radium implants. You wouldn't necessarily go to a prostatectomy. Now, did they do that and it progressed anyway? I don't know. Or did they observe it and whoops, it got away from us because it turned aggressive. We weren't prepared for it. I don't know what happened, but it didn't happen the way they said it did. It didn't. Listen, I don't want to accuse anybody of lying. I wasn't there. I didn't examine the patient. But the fact is, I've never seen a situation, I've treated a lot of prostate cancer, where you go, I feel a nodule. And again, that already is suspicious because you're going to be responding to the PSA before you worry about nodules. But what was the PSA? When did it start climbing? Those sorts of things. And my bet is it was 2 to 3 years ago. That's my bet. And if you look at Joe Biden's decline, it kind of accelerated about 2 years ago. So you have to wonder, I wondered if he was getting treatment for his Parkinson's disease and that was affecting his cognition. That's another layer of intrigue in this story. But now it's starting to look like, well, maybe they knew it was metastatic disease and they started to put him on androgen deprivation therapy back then, which would be the normal progression of things. Now, the physician you had on before, I could tell, doesn't treat prostate cancer now and isn't involved in current research. These days, you can actually send radioisotopes to each individual prostate cancer cell. And that's the way you would treat somebody like a president. But there's no talk of that. I don't know what they're doing. Has he not progressed? They're not telling us anything. And there's an interesting question in here. To what extent does someone who's responsible for leading the free world have an obligation to tell us about his own individual private medical conditions? What is that obligation? And people are not having this conversation. It's an important one to have.
Yes, it seems like something that is constitutionally mandated in a republic where the change of the guard would then go immediately to the vice president. There's succession here. If Joe Biden has a terminal, as our last guest put it, I'm not sure if would you agree with that?
100%. It's not a curable disease. Even with some of the fancier stuff I was describing, the cancer is brilliant. It comes back. It finds a way to push through that. And so, yeah, it is at this stage of history. Although one day we look to curing it, at this stage, certainly terminal at 5 years from onset of metastatic disease, which we don't know when that moment was.
So, forgive me for losing it here, doctor, but that is important material information that the president has terminal cancer.
Yes.
They were running him for president, putting him up for debates, having him taunt Trump, say, make my day, pal, while he has terminal cancer? This is insanity, doctor.
It's insanity. I agree with you, and that is why I'm using the word scandal. This is scandalous. And it goes right at the heart of, like I said, I woke up this morning thinking every journalist that was gaslighting us, that was telling us nothing to see here, sharp as a tack, photographic memory, every one of you should wake up this morning, and there's a lot of them out there, and apologize. Van Jones started to do it. I don't know if you noticed. He's going that direction right now. And Van's a great guy and a smart guy. And I expect to see him lead his journalistic colleagues into this, which is we got played, we got gaslit, we bought it, we didn't do our job, and we need to do better. And we need to get on top of this story right now so we can fully understand it so this never happens again.
Doctor, I just want to change hats here for just a moment when it comes to the timing of this. There are many people saying this seems quite suspicious. Jake Tapper, who is Van Jones's colleague on CNN, is coming out with a book, Original Sin. It's apparently going to be brutal. It drops in 24 hours. So what do you believe about the motility of potentially releasing this news as an absorption for the criticism of that book and other reporting.
Back to my sniff test, right? It's like, wait a minute. Why did they select this moment to release and to try to gaslight us again about, excuse me, oops, we just discovered it? No, we're not buying it. The good news is, by the way, in all of this, is we have alternative media like yourself out there going, whoa, wait a minute. We don't buy your BS anymore. We don't buy lockdowns. We don't buy mandates. We don't buy the gaslighting that you put us through when we can see who you're going to believe, me or your lying eyes. I'm going to believe my eyes, what I see, what I know to be true, and we're going to figure this out. The fact that they did this now, they did it in a way that was inaccurate. Oops, we found a nodule. Oops, metastatic disease. So already there was something wrong with what they were reporting. And they selected to report it. Now, my bet is they were going to try to hide it until he died and then say, oh, he just had really aggressive disease and he died. And then maybe a couple years down the road before the disease really takes him out. But they couldn't. They have this problem coming with the cognition. Look, frankly, if they were smart, they would say, look, he had Parkinsonism. He had Parkinson medication that slowed him down a little bit. He had prostate cancer. They gave him antideprivation therapy. Yep, makes you sleepy, makes you fall, makes you a little slower, but he was still making good decisions. They could make that case, but because they are such lying, duplicitous, gaslighting, there are stronger words I could use, but it's my first time on your show, so I don't want to go all the way there. But that's the problem here, and that's what we must examine carefully, and that's what we've got to understand. So we see it next time, and so we don't fall victim to this. This is not okay. This is not the way this country should be run.
Yes, I like separating the moral question, which is that you don't wish cancer on anyone.
No.
And I didn't actually know that you that you yourself have gone through prostate cancer. I didn't know this. So of course you would never do that, right? You'd never do that. But you need to also ask the question: if the president has a terminal illness,
yes,
we live in a constitutional republic. We have a right to know, because this guy's negotiating peace deals or starting wars.
Yes,
this is a terrible way to run a country. And that brings me to a moral question for you, Doctor.
Okay, here we go.
Which is Jill Biden.
All right.
There's no doubt that Jill Biden knew. You have to assume this. And as a
Jill
wife,
Biden, Joe Biden or Jill Biden?
Yep, Jill Biden, Jill, the wife of Joe Biden, for 4 decades. You have to at some point start asking the question, like, what did Jill Biden know? When did she know it? And how would you, if you love someone, how can you allow the pressures of the most grueling job on earth to befall their shoulders when you know how sick they are? Why would you allow them to keep being trotted out like a show pony, getting whipped on The View? I mean, it's very humiliating. It's degrading, actually. And we're arguing. I can't believe I find myself in this position, Doctor, but I find myself arguing in favor of Joe Biden as Joe Biden's friend, saying this is immoral to do this to him.
Yes, I don't know that I would call that immoral, but it certainly is problematic.
It's not love. It's not love, Doctor. You know,
but I can tell you, and I would made this the last couple of years. I was making this case on behalf of Joe Biden's family, which was, it's another family like every other. And when the patriarch starts to get sick, they go into denial. They go into support. He has something called anosognosia, right? Mm-hmm. Alex Berenson wrote about this the other day, and I thought, oh, he is absolutely right. Anosognosia is a neurological state that people get in where they block their insight into what's happening to them. It happens with many neurodegenerative disorders. It happens with schizophrenia and bipolar disorder and addiction. And we are in denial about the denial associated with anosognosia. And in family system where there's an important patriarch, the system will sometimes kick in and support the denial of the patient. They don't want him to have to come to terms with the reality of what's before him. They may be as severely in denial as he is. And let's remember, Jill is not biologically or clinically trained at all. She may not understand what this is. She may reject what she's being told. She may not be able to process it. So she may be equally as in this denial as he is.
What happens next with these pardons, Doctor? What do you? I mean, Dr. Fauci is not on your Christmas card list. I know that. And what happens next, right?
You've just leapt outside of my field of expertise. But let me see if I can come in. The one thing I would say is, again, if they were more honest, if they could be clear and honest and transparent, here to me is a possible defense, which is, hey man, he had Parkinsonism. It was forget what, Parkinson's disease and Parkinsonism are, they look the same, but they're different things. But I'm willing to just have them tell me he has Parkinsonism. And one of the features of Parkinsonism is you lose the ability to write clearly. And you can even lose the ability to sign your name. And so if they were to say, you know what, we had to use the auto pen because it didn't even look like his signature anymore, and he directed every single one, I promise you, that's that. But he couldn't actually sign it himself. That's their only defense as I see it. That's the only one. But they are not honest enough to use the one thing that you could have sympathy for.
It does seem like they're lying themselves. This might have been a failed PR. Mark Halperin talking a lot about this, how this was intended to be a PR offensive against Jake Tapper's book, but it actually just looks like there's more lying. It looks like what you've done is you've revealed further and greater and deeper lies, actually, that we didn't even know about. Backfired.
How they couldn't understand, the physicians would go, that doesn't fit right. How they couldn't have understood that is bizarre. It's like, what do you think? I guess they've had their way with, who is they? First of all, I'd love to know that. And secondly, they've had their way with us for so long that they just to become hubristic and sloppy. And we're starting to see through it now, and thank God we are. And let's not let this happen again. I feel bad. Look, I share with him the diagnosis of prostate cancer, and if I were to ascend to some important office, you would have everything. You have all my records, much the way Trump takes the cognitive test, does everything, throws it all out there. Yeah, you can put your record out there for the public to scrutinize it, and then make your case about your suitedness for the office, whatever office you're running for. But man, we live in weird times. We really do, Benny. If had we not been just through the COVID catastrophe, this would be astonishing to me. But to me, it's just more of the same. The gaslighting, the distortion, the rendering the population delusional. Literally, journalists were delusional about who their president was, and their delusionality caused them to come in on the side of these extreme distortions. They need to look at themselves. They should be really ashamed, and they should be anxious to do better.
So amazing you brought up this delusion. I wasn't planning on doing this, but we just can't get over this clip. It's from 2022 where Joe Biden, mid-interview on MSNBC, just gets up and just walks off.
Oh, yeah.
Just walks off the set.
Yeah.
And Nicole Wallace is trying to ask him a question, and she's fawning and groveling and toe licking and boot kissing.
Yeah.
And he just gets up as though he's in the middle of a crisis, maybe like something gastrointestinal. I don't know. I don't pretend to know. But clearly he's in peril. And Joe Biden hurries and scurries off set.
The only time I had seen a president walk out of some public event like that is on 9/11 when somebody whispered in George Bush's ear what just had happened. And he moved off. If Biden thinks for a second that we're going to imagine that he has something important to get through as he shuffled off, by the way, the gait was classic Parkinsonism when he shuffled off that day, as he often was. But yeah, and then again, Nicole Wallace should be examining herself. Why didn't she? If you look at those clips, she comes back on with glee on her face. Oh, yeah. Isn't he great? You need to examine yourself, my dear. You really need to look at the job you are doing and why that happened to you.
So setting that aside, let's swerve quickly back to your lane here. Dr. Kevin O'Connor. Is there, Americans still have such high regard for doctors, and there is a rule book, unlike the presidency, which should have fitness tests clearly, but doesn't. There is a rule book for doctors.
Yeah.
And what do you believe perhaps should happen to Dr. Kevin O'Connor? Should he be subpoenaed? That many people are calling for that. There should be a full investigation. I mean, it was the American Republic at stake here.
Yeah.
A lot of damage was done during the Biden presidency, and many are now calling for truth and reconciliation. And I believe that would probably focus in on Joe Biden's physician for all 4 years, Kevin O'Connor.
It would, however, to me, it's outside of his medical practice upon which he needs to be examined, in the sense that we have an absolute obligation to maintain the confidentiality privileges of our patient. And he may have put that at the head of his priorities. And it's not an unreasonable thing to do. I don't think it's the right thing to do, but it's okay to have done that. But there may be other aspects of that, what the consequences of that choice were, as you said, that have constitutional implications through which he can be examined more clearly about the choices he made and the, God knows, the influence he was under to make those choices, which is another aspect of this. There's another whole layer that people are going to get into, I know it, which is vaccines. There's Patrick Soon-Shiong is out there talking about how the spike protein, COVID virus, COVID vaccine, has knocked out our natural killer cells, and our natural killer cells are our last defense, our sort of scavengers against cancer. And that's some of the reason we believe there's a theory. Again, I'm not bringing in on this theory that's why we're seeing the accelerated rates of cancers and things. If indeed that's in fact true, we may be sort of seeing what we want to see due to some sort of anticipation bias. But that will start to be. I'm seeing it on Twitter right now. People are, it's a turbo cancer. It must have been because he had so many vaccines, so many boosters. Possibly, but we're not in a position yet to say that. But that's going to be the next layer of this conversation for people to get excited about this stuff.
How do we stop this? I mean, just in conclusion here, how do we stop this from happening again? Like, what would be the Dr. Drew regimen to ensure that we have healthy presidents? Man, I got to tell you, I'm sick of being lied to. And you're right. You're right. FDR was in a wheelchair. FDR was in a wheelchair.
Yeah.
It was different times. And Americans are responding to one thing and one thing only: transparency, accountability, and authenticity. And that's what Americans demand. It's what we should have always demanded in this country. And so, no, you can't live in a wheelchair in secret anymore, right? Neither can JFK go, bang a bunch of movie stars in the White House, like in secret anymore, right? And I think you can argue that
for that, right?
It's good. It's good that can't happen, and the American public should be fully read in as to who their leader is and their health. And how do we? What would be your system to fix that?
So what I would say, the issue is cognition, right? What do we care if somebody has, motoric difficulties or whatever, they're in a wheelchair? Nothing, zero. But cognition, we are very interested in that. We also should be interested in their psychiatric state. I mean, if they suddenly become bipolar or manic or something, we need to know that. So I think there ought to be, I don't know how you operationalize this from, again, a constitutional standpoint, but if you notice Trump does the Montreal Cognitive Inventory every year. That is a great way to sort of screen people. We should agree upon what the minimum score on that should be for a president. There should be some sort of mental status exam that suggests that there, again, some sort of criteria for what it's a slippery slope, people will say, to go down these paths, but people should be in a condition where they can function. By the way, they don't necessarily have to be taken out of the presidency if they're depressed or something. They can just be removed for a minute till they get proper treatment. But the reality of our brains and our brain science and our aging needs to be brought into the modern era as it pertains to our leaders, it seems to me. And so that would be my way of doing it. Now, the other thing you've mentioned a couple of times, that it should be hearings, there should be some sort of reaction for what this physician chose to do. I'm very concerned that there's some saber rattling around things like vaccine safety and whatnot. I'm going to caution people, please don't get in a mode of wanting to be punitive. I understand the feeling, but if we insist on some sort of, you hear all kinds of things about Nuremberg too and all this stuff. If people go that direction, the people whom you want to scrutinize are going to go into complete defensive mode, as they should, and you're never going to find out the truth per se. We need to go on a truth-finding mission so we can understand what the last 4 years has been about and what we do to prevent this from happening again, without necessarily some sort of consequence for those that chose to do this to us. I understand the impulse, but we got to get to the truth. Otherwise, it can happen again.
If you were to ask me to choose one, doctor, I'd say absolutely. I will take the reinforcement to ensure it never happens again, against some type of punitive action against some low-level staffer that ran an auto pen. Like I'd rather us have a like they're doing this at the FBI right now with Cash and Bongino. It's like I'd rather fix the systems than to get some type of like instant scalp and then have a broken system for the rest of my life that my kids have to live under, right? And then my kids have presidents with dementia. That's a terrible country to leave to my children, right?
Yes,
so it's like
correct.
Okay, so very quickly, I've never done this on the show, but can you please give me advice? I'm on the wrong side of 30. Can you give me advice to ensure, and we have a bunch of young men that watch the program. Since you're on the prostate cancer board, is that correct? And if I'm getting that name correct?
Yes. So Prostate Cancer Foundation. So
can you give just some advice to make sure that we're not in this, we don't find ourselves in this state?
Simple. If you have a first-degree relative with prostate cancer, you should begin getting PSAs every year at age 40. Everybody else should begin at age 50. If you're of Norwegian, Scandinavian descent, you might want to hit 40, even if you don't have it in your family per se. It's a much higher risk. African-American men of African descent, have a much higher risk of serious disease. You must take this seriously. We're doing a horrible job of screening Black men. You must take it seriously. You must go in. The treatments are fine. I'm fine. I've been treated for my prostate cancer. No side effects. Men hide from this one because I don't want to know because it's going to affect my erectile function or whatever. Not today. Not today. We can do a lot with this without affecting your life and your relationships. So just do the proper screening. I have a lot of very simple advice for you guys, but resistance training, everybody, make that a part of your daily life from now until you're Joe Biden's age. Resistance training every day.
Resistance training, weightlifting, getting in the gym.
Do not leave out weightlifting. Cardio, not so much. If that's what you do, you love it, okay. But resistance training is the key. Sarcopenia is the enemy. Trust me, this will improve your health overall.
Fascinating. We'd love to hear it. We're just sitting, my team sitting here nodding in the studio like, hey man, we're getting advice from Dr. Drew. Perfect. Here, ladies and gentlemen, you should.
Well, here's the deal. I'll have to. This will be a teaser. You'll have to have me back to deliver a few more pearls for you. See, I'm going to hold it right here, so you'll have to have me back.
Please, of course. It's our great honor, and our production chat made up primarily of young men is like going. They're eating this up. So thank you.
I got a lot to say to young men. I got a lot to say. Got a lot.
You're changing and saving lives. Here, I believe we have. We have the Prostate Cancer Foundation, right here, and so you can see that, and then you can see Dr. Drew's on X. Put up the foundation, please, Klein.
There's an excellent foundation. We fund the best. We fund the most creative, incredible research in prostate cancer.
There we go.
And the breakthroughs we've had, and the breakthroughs we've had in prostate cancer have improved outcomes in other cancers, including breast and ovary. It's just a marvelous organization. And if you have any question about prostate cancer, go there. They can answer for you.
Millions and millions follow Dr. Drew, the good doctor. You can be one of them. Here's his X, but also his YouTube show is poppin'. Board certified internist. Ask Dr. Drew. Dr. Drew, ladies and gentlemen, make sure that you're locked in and please come back. We have so many different questions for you, Doctor.
All right,
Thank
Benny.
you for shedding light.
I will.
Here.
Thank you.
Godspeed.
Bye-bye.